And the last question is the very interesting. Why? Today we learn all about bio-stimulator and we know about HYAL filler. But how to mix and match, how to combine bio-stimulator and filler in clinical practice. So I think no one to know more detail than him. I would like to welcome Dr. Kwon Han-jin, who will share his knowledge of ULTRACOL and HYAL filler in your clinical practice. Welcome Dr. Kwon in unique characteristic of HYAL filler and PDO biostimulator.
Hello, I'm Dr. Kwon. Thank you for inviting me here. Very warm season. Right now in Korea it's very cold. So when I come here I feel very warm. It's nice to meet you here. I just want to take some simple point and then I will show you more on the videos what I'm actually doing. I just want to show you some different points with the ULTRACOL and some other things. We had recently many research done. Okay, this is a very interesting study done by Seoul National University Hospital, which is considered top 1 university in Korea. We did 31 patient about skin roughness, texture, volume, skin elasticity, moisture, brightening, pores, skin density, comparing with Rejuran. I'm sure you all know this product, the PDRN, Rejuran, and the PDLLA, which is also famous in Korea about the PLLA, another PLLA copy product called PDLLA, called Juvruk, and non-cross-linked HA, which we use for the moisture and hydration. So we did a 31 patient double-blind test. Patient don't know which one is shooting on the left side of face and also right side of face. And doctor also doesn't know which is the product. So it's quite interesting. And this is a skin booster. So as you can see here, the roughness of skin means the wrinkles, okay? The fine wrinkles usually. So we did a 2 shot of treatment. One, let's say one today, after 1 month, another second shot, and after 2 months, we did a measurement, okay? So this is a PDRN, Rejuran. Actually, the roughness of skin go down, more better results. So this one doesn't have a result, I mean long-term result. And this is a skin booster called the Juvruk PDLLA. This showed some result, but can you see after 2 months, they showed some result initially after 1 treatment, but after long term, they didn't show really good result, okay? But can you compare with the PDO ULTRACOL? After 1 shot, after 2 shots, they show more gradual increase in the effect. This reason, we will tell you scientifically why it happens like this after a few minutes. And this is a non-cross-linked HA. We used to use it all the time. Also, you can see there is no long-term result. But with the ULTRACOL, you can see after 1 shot, after 2 shots, you see a lot of a result after 8 weeks. And this is about the skin texture. Skin texture with the PDRN, didn't show any significant effect after 2 months. That's why, do you know the product called the Rejuran? I've been using it 6, 7, 8 years ago, long time ago, but now I don't use it like before because many patients has a complaint of the pain and they said the result lasts only 2 weeks. Okay, so that's the usual feedback from other Korean patients. So you can see the skin texture doesn't show any significant effect after 8 weeks. But ULTRACOL, after 8 weeks, it showed dramatic effect. So please try also the skin booster, ULTRACOL 100, then you will see, you will know what I mean. This is a comparison with the Juveruk, again, the PDLA. Didn't show significant effect after 2 months. Also this one, I have a lot of patients come to me, they did the skin booster with the PDLA, but they don't see any effect at all. You know, if you want to really see the effect, you have to inject directly into intradermal layer. Then what will happen? There are some doctors doing it, but you know, when you do the skincare like this, after the injection of this PDLA, your skincare therapist will tell you, oh, I feel like something hard, many small hard things on the skin surface. You see, that's the one they shoot with the kind of machines, you know, without needles. We have in Korea, Mirajet, CureJet, AirJet. We have many of machines we shoot without needles. So they stay there and they feel like something like that, okay? And then you can see the comparison between ULTRACOL, the PDO product. So I want to tell you, you try to test the product on the left side with the other PLLA or, you know, other product, and you try to test PDO on the other side. You will see it. You can find out for yourself. So you can see the skin texture has a great improvement compared to others. And the volume. You know, you have to find out the real natural volume. Actually, our new paper is coming out again on the March from Seoul National University. We tried the PDLA and the PDO ULTRACOL again, and we have all the scientific data. You have to understand the PLA, PDLA, their volume is not due to collagen stimulation, you know, because this product, the PLLA material, I mentioned to you many times in my lecture before, they are very stiff, hard product. So whenever you inject 3 times of the Sculptra or the Acetafil or Juvero, you know what the patient will tell you? Oh, my skin looks like a very stiff. I feel unnatural. I feel like my skin is not my skin. Okay, that's the usual reaction of the patient. So we found out another journal, we will tell you starting on March, they act like a matrix. They don't really produce the soft collagens like a PDO. So you have to understand the very secret. So you can see the volume, PDO increased dramatically with a natural collagen volume, but the Rejuran and the PDLLA didn't really show after 2 months, okay? So you have to understand. Because they have a short-term effect. Why? Because this PDLLA has a 15% of a HA. So that's why initially they have a short-term effect, but long-term effect, it didn't really show. So we have many studies, elasticity, also they improve with the PDRN, but ULTRACOL improved more, and also elasticity improved with about 1% with the PDLLA, but ULTRACOL improved a lot more. So in many studies, moistures, okay, in many studies, in many different areas, PDO showed much more dramatic effect. Okay, as you know, this is the PDO. You know, UltraV has a technology. We have actually produced the PLLA 7 years ago. And this is a before plasma treatment. This is the PLLA particle. And we made it very round, okay? And then this is after plasma treatment. Can you see more pores? So at least it will help to absorb easier, faster, and also more stimulate collagen because of this a lot of pores on the surface. And this is a Sculptra, as you know. And you know the Astafil, actually they are the PDLLAs, okay? So they have a PLLA, they have a PDLA, so that's why they call it polylactic acid. And this is an Astafil. And do you know that the manager, factory manager of the Astafil came out and made a company, and he made this called the PDLA product. So actually, they are very similar. The only different thing is they made, and very irregular, you know, they made the particle smaller than Astafil, smaller than the Sculptra. This is the, okay. So this is the ULTRACOL 100, this is a Juveruk 50. They made the particle smaller. So what does it mean? When it's smaller, less nodule, right? That's correct. But you have to understand less effect. That's why if you compare the ULTRACOL Skin Booster 100 and the Juveruk Skin Booster 50, then you will see the answer, okay? And you have to look into this point. The PLLAs, their melting point is 140 to 150 degree, but the PDLLAs, their melting point is 230 to 240. You know, initially I was thinking they have a same melting point, but I'm doing a lot of RF cannula to melt the previous fillers. I found out this Juveruk PDLLA much more difficult to melt. Okay, I have an uncountable patient coming for the melting the previous filler. So this 140, 150, and they are very glassy, stiff. And the Juveruk also, they have a glassy and stiff, and the melting point is much more higher. So be careful. Once you produce a hard nodule, they will not go away easily, okay? So right now in Korea, many young doctors, and they are doing the YouTube. Right now, they say, never use Juveruk under the eye. You got my point. Before, nobody talk about these things. I'm the only one talk about these things. But nowadays, many Korean doctors in YouTube says, please don't use this PDLLA under the eye. Never use, okay? So what I was telling you become true right now. Because in Korea, we experienced this PLLA 13, 14 years ago, Astafil also 10 years ago. We use a lot of different polymers, so we have a lot of experience. So I'm telling you. Nowadays, it's totally different from 10 years ago. Why? Nowadays, if you produce any nodules, any problem, they will sue you. They will ask for money back and more money, okay? That's the problem. 10 years ago, 15 years ago, it didn't happen like that in Korea. But now, everywhere, same. So we don't want any headache. Do you understand? So be careful choosing the product. You have a more safe product, PDO. Why do you have to use the PLLAs? Okay? In Europe, I went to Europe last week, Paris, MCAS. They also say same things with me. They don't like this PLLA product, a lot of headaches, okay? And also, there is a product called the Gauri. Actually, didn't get Korean FDA approval yet. But you have to understand a lot of allergic reaction, anaphylaxis reaction occurred. But we don't know the reason why, but we are suspecting the product, the material called the PEG, polyethylene glycol. Polyethylene glycol, it's already in the big news in Korea, okay? Polyethylene glycol, it causes a lot of acute systemic allergic reaction called anaphylaxis. and anaphylactic reaction due to elevated level of antibodies to PEG. So when you are using the product with the PEG, be careful. Okay, these are some new points that I want to share with you, and let's go to the video. I'm sure you heard a lot of about this HA filler today. So the HYAL filler is a multi-phasic. So it has an advantage of the monophasic and biphasic together. So, you know, we don't use filler like before in Korea, but there are, of course, a lot of patients still need to use it. Wait, why is it does move? Wait, because it doesn't move. It doesn't move. No, I want to go out first. But it doesn't move. Control Alt Delete. Okay, so no, nowadays, even I'm going to use the filler, usually use less amount than before, because, you know, about 10 years ago in Korea, we use like a one patient, 10 cc, 15 cc. We use a lot of fillers before for one patient, but nowadays, so many young people don't like filler like before, or they don't want too much swelling or look unnatural face. So we have to minimize the filler and natural look. So we combine, I'm doing combining with the ULTRACOL 200 and the HA filler for the sunken areas together. Okay, so for the under eye, we have a two approach from the lower to upper for older person, okay, and we have a young person. You can just go from the side, but when you go from the side, try to reach up to the nasal border. Why? Because I tell you all the time, the PDO has a great stretching effect. You have to understand, PDO has a great stretching effect. So you should not shoot like a filler. Small shoot, small shoot, small shoot. No, never do that. You have to make it continuous, okay? Continuous, then you will see magics, okay? And under eye, the only thing you have to be careful is just don't shoot too much at once, okay? So one line, about 0.1 cc, okay? So it's very easy. And temple area with this lateral canthus area here, I found out so many patients with a sunken area here when you get older, okay? But we have no product can shoot here safely. Can you shoot Sculptra here? Can you shoot Estafil here? Can you shoot HA filler here? It's not going to be natural. Sometimes you produce a problem. So only the PDO, and especially if you shoot continuously up to here and up to here, shoot, then you will create one collagen lines, two collagen lines, three collagen lines. You have the natural lifting around the eye areas, okay? And the temple area, usually before I try to put more soft fillers, but ULTRACOL, I was thinking, oh, ULTRACOL has an effect on this area or not. But I found out this area very good, very, very natural effect. So many patients love it. So we can shoot with a fan technique, small amount, then the result is not bad. And this hollow area, of course, we can use the HA fillers. Usually we have the fine, medium, hard. I use the medium ones here. So a little bit more deeper than the PDO powder. So our PDO powder, ULTRACOL, more superficial layer, and this one a little bit more deeper, okay? But always, don't shoot one area too much HA filler. Why? Also HA filler, if you shoot one area too much, they will make a capsulization and they will not melt away. They will stay there for a long, long time. I remove a lot of HA fillers already more than 10 years, okay? I have a lot of evidence, proof. So please don't put one area too much, okay? Spread it. Even though HA filler, spread it so they will absorb. Because nowadays patients love to absorb faster. Okay? Of course, nasolabial fold also. I use here maximum 0.5 cc. Why? If you put more than 1 cc here, they will all, by the movement, they will migrate and this area will become more bulkier. We call it like a monkey look. So you don't want to produce monkey look, don't shoot too much. 0.5 cc maximum, okay? And also we can put multi-layer the fillers, subdermal, a little bit deeper, 2 or 3 layers, okay? And you can shoot a little bit more on the, up to the fossa here, so you can create natural look. Okay, just don't shoot too much, always. If it's locking, you can shoot one more time, okay? Just don't shoot too much. And here, it's quite interesting. Did you see I shoot the ULTRACOL up to here? This is for the lifting. Did you see I shoot up to here? Why? You know, many patients, especially after 35, 40, your face is become bigger because of this area is bulging. You know that? So this area is bulging. So if you don't reduce this area, you cannot make someone's face smaller. You know, many people do Thermage, Ulthera here. They have a very shiny, look good skin, but their face, they will come back, oh, Dr. Kwon, why my face looks bigger? Because of this region, okay? So you have to control this one with ULTRACOL. They can make it smaller. And this marionette line, here usually people have the sunken area here, right? So I usually put here two layer, and then the other area, one pass superficially, subdermal layer. Okay, so I'm going to use 2 wire for the full face lifting. If under eye and the laterals, I can use only 1 wire of ULTRACOL 200. So usually, yeah, we do. Okay, I just show you this one. The patient has a sunken area here with many people with the dark circle here, right? So please go slowly. Because if you stop here, the actual area you start to shooting will be here. So if you go here, then the actual area shooting will be here. You know, you have to understand this secret. You have to pass the point where you're going to inject. Usually HA filler we don't put here, right? So no HA filler, but ULTRACOL possible, very safe. Okay, so I just go quickly. Even doing the HA filler, I always use cannula. I love to use 23G cannula. You know why? I don't consider 27G, 25G as not cannula, just like the same with the needle. So if you don't want to have any accident, vascular accident, please use 23G, 22G, 21G. If you get used to it, you will find it much easier than needle or much easier than 27G, 25G cannula. Okay? So again, can you see this area? Lower area of the ear. This is a very important area to make someone's face smaller, okay? This is my secret to make it smaller. Of course, I can use a thread, but if you don't use thread, you can do ULTRACOL. We have a wonderful powder liquid thread here. Easy. You can do it easily. Here, even you shoot many by accident, you never produce any lump or you never produce any granuloma. It's perfectly safe. I cross my heart, 5 years, I have no nodules under the eye, and we don't produce any granuloma. There might be some, if some doctors should mistake, you might have a little bit lump-like, you can break it with the RF cannula or your cannula. So it's a very, very safe product. That's why now in Korea, this product going very, very high. I just want to show you just few pictures. Okay. Under eye, just one treatment, very natural. This patient did some other product, become like this, here. So after one treatment, more natural. Finish. This patient did a Juverup PDLLA and they become very irregular. So I use RF cannula with ULTRACOL. Just one treatment, improve a lot better. The RF cannula ULTRACOL, this is after surgery, the aversion ectropion with the scars, very difficult case. Second, third, after 5 sessions in 2 years, 1.5 years. Patient did the under eye, the fat removal. Can you see many patients coming here with the sunken problems? So after ULTRACOL, so they did a surgery. They made a problem, but we can fix it. Hand rejuvenation, fantastic. Neck rejuvenation, also fantastic. Under eye. This is a very interesting case. Can you see this sunken area here? She used the lipolytic similar to Cabela, and then she has something like an atrophic problem, very atrophic. No one can fix this one. But I shoot the ULTRACOL 200, I shoot ULTRACOL 100 together at same time. Only one treatment, she improved like this. Can you imagine? She went to 3, 4 hospital clinics. No one can fix this one. We improve it with PDO, 200 and 100. You see these problems. When you do more patient, you see some patient with the bulging, some patient with the sunken. This is a very difficult case. Why? If you shoot too much here, what happens? It will also bulging out. So you have to make a good design, something like this, and then after 3 sessions. Also ULTRACOL 200 from our Spain doctors. You look at their skin texture, it's glowing amazing, Also, in Korea, they do a lot of liposuction, and then especially this navel area, we call it donut deformity, become very loose. If you do more liposuction, then you have the loose skin. You can improve it with the ULTRACOL 200. I did a few cases already, a lot good result. And can you see the scars after surgery? After surgery, this patient went to many clinics to want to improve this hypertrophic scar, but cannot. But I use ULTRACOL 100, improve a lot. Can you imagine? We can do a lot of scar treatment with the ULTRACOL 100. Okay, under eye is very good. This loose case, please don't shoot here too much. You should hear a little bit, here very, very little, you should hear more. So you can improve the under eye problems. Okay, so I think under eye, very good. Under eye also, you see the old people, she don't want to do surgery, so we do. Also these problems, very difficult to treat it with the fillers, you know, but improve a lot. Also under eye problems here, a lot improved. Under eye, also this one after the second treatment. So can you imagine this patient from Thermage burn? You know, Thermage burned. She was really crying. She went to many hospitals for scar. They say this will last for a long time, but we remove with the ULTRACOL 100 and PRP together, air dissector. Here, filler, a lot of filler, bulging. She tried to melt with the HYAL 4 times, no melting. So we use the RF cannula a little bit and we ULTRACOL. So we have a lot of case. Okay, this is just removing the HA filler which was there, and this is a ULTRACOL with the air dissector. So after air dissector, shoot ULTRACOL 100. We have a lot improved with this forehead wrinkles. So anyway, so these are some of the updates with how to use the ULTRACOL 200, 100. So you have a more indication to go. So please try. Thank you very much.
Okay, thank you, Dr. Kwon, for amazing presentation and video demonstration. ULTRACOL can improve your skin texture, volume, and brightening. และสุดท้ายนี้นะครับเดี๋ยวผมขอส่งต่อเวทีนี้ให้กับคุณหมอมิกแล้วก็คุณหมอใบหม่อนนะครับในการปิดงานนะครับ
ต้องขอขอบคุณสปิเกอร์ทุกท่านนะคะที่ให้เกียรติมาบรรยายแล้วก็แชร์ประสบการณ์ดีๆให้กับพวกเรานะคะรวมถึงโมเดเลเตอร์ของเราด้วยนะคะที่ทำหน้าที่ลำดับต่อไปขอเชิญสปิเกอร์ทุกท่านนะคะขึ้นเวทีเพื่อถ่ายรูปร่วมกันนะคะ
วันนี้ก็ได้ความรู้แล้วก็ความมั่นใจในการทำงานขึ้นเยอะเลยนะครับสำหรับการประชุมวิชาการ The New Era of Aesthetic Integration ULTRACOL and HYAL Filler นะครับก็ได้จบลงเพียงเท่านี้นะครับสำหรับแพทย์ท่านใดที่มีลงทะเบียนเวิร์กช็อปเอาไว้รบกวนติดต่อทางทีมงานนะครับเพื่อพาไปที่ห้องเรียนเวิร์กช็อปต่อไปครับสำหรับวันนี้นะครับขอขอบคุณผู้ร่วมงานทุกท่านนะครับหากมีผิดพลาดประการใดทางผมแล้วก็ทีมงานทุกท่านขออนุญาตกราบขออภัยมาณที่นี้ด้วยครับ